Those first few weeks with a newborn are a lot. They're amazing, but let's be real, they can be super stressful. Today, we're going to get into a topic that can feel pretty scary, neonatal infections. But our whole goal here is to cut through the noise and the fear and just give you clear, straightforward information so you feel empowered. All right, let's jump right in. Okay, picture this. This isn't a scene from some TV show. This is a real case. A tiny 3-week-old baby suddenly in big trouble. This kind of scenario just throws you right into the deep end, and it shows you exactly why knowing even the most subtle signs of an infection is so important. So, when you're a doctor and you see a baby with these kinds of symptoms, a whole bunch of alarm bells start going off. What's the number one concern? What is actually happening to this little one? Well, all of these signs are pointing to a really serious, life-threatening condition called neonatal sepsis. And you can think of it like this. It's a massive infection that's gotten into the bloodstream and is now raging through the body. And it means you have to act fast. Now, here's the tricky part. The signs can be super vague. So doctors are in a race against the clock. They can't just wait around for lab tests to come back, which could take a day or more. They have to look at the baby, assess the symptoms, and make a call right then and there, because every single minute is critical. So what exactly are they looking for? Well, it can be something as subtle as a baby who's just extra fussy and irritable, or the complete opposite, a baby who's just too sleepy and hard to make up. Maybe they're just not interested in eating. And get this, it could be a high fever, or their temperature could be dangerously low. A bulging soft spot on their head, or seizures, those are really late, really serious signs. The big takeaway is that these symptoms could be red flags, not just an off day. You might be wondering, are some babies more at risk? And the answer is yes. Premature babies are especially vulnerable because their immune systems just aren't fully developed yet. Also, if the mother had any kind of infection during labor, like a fever or an infection of the amniotic sac and fluid, which is called chorioamnionitis, that definitely raises the risk. So to confirm what they suspect, doctors launch into what's called a sepsis workup. It's basically their detective work. As you can see, it's a very methodical process. They'll start with blood tests, they'll culture the blood and urine to see if any bacteria grows, and then they'll start using imaging, like a chest x-ray, and sometimes a lumbar puncture to pinpoint exactly where this infection is coming from. And one of the very first places they're going to look is the lungs. This chest x-ray lets them check for pneumonia, which is a really common culprit behind sepsis in newborns. Okay, now this next step, a lumbar puncture. I know it sounds intense, but it is absolutely essential. By taking a tiny sample of the spinal fluid, doctors can check for meningitis, a really dangerous infection of the lining of the brain and spinal cord. Finding out if the infection is there is a complete game changer for the treatment plan. All right, so we've been talking about sepsis, which usually develops after a baby's born. But there's a whole other category of infections that a baby can get during pregnancy by crossing the placenta from the mother. And these pose a totally different kind of challenge. To help remember this specific group of infections, there's a really handy acronym that doctors use. TORCH. Each letter stands for a different bug that can cause some serious issues for a baby while they're still developing. So let's do it. Let's break down what each of these letters in TORCH actually means. We're going to do a quick tour of these infections and the classic signs that give them away. First up, T is for toxoplasmosis. You've probably heard of this one. It's the reason why pregnant women are always told, hey, maybe let someone else handle the cat's litter box. It can be passed through cat feces, but you can also get it from eating undercooked wheat. And the damage this can cause is, wow, it's devastating. On the left, you're looking at a brain scan. All those little white specks, those are calcifications, kind of like tiny scars scattered throughout the brain. And on the right, you can see one of the possible results, a condition called hydrocephalus, which is a dangerous buildup of fluid that makes the head swell. So for doctors, when they suspect toxoplasmosis, they're looking for this classic triad of symptoms: that hydrocephalus we just saw, those widespread calcifications in the brain, and a severe inflammation in the back of the eye called chorioretinitis. Next in our acronym, R is for rubella, also known as German measles. We don't see it much anymore thanks to vaccines, which is great, because congenital rubella has some very distinct features: cataracts in the eyes, heart problems, and this very unique-looking rash that they call blueberry muffin spots. The C stands for cytomegalovirus, or CMV, and this is a big one. It's actually the most common congenital infection. Now, just like toxoplasmosis, it can cause those calcifications in the brain. But here's the key difference. Look at the pattern. With CMV, they tend to cluster right around the ventricles, those fluid-filled spaces in the middle of the brain. That's a huge clue for doctors. And finally, H is for herpes. A newborn can get this during birth if the mother is having an active outbreak. It can cause sores on the skin, but much more dangerously, it can cause a severe eye infection and can even spread to the nervous system, which can be absolutely devastating. Okay, I know that was a ton of information to take in, but if there are just a few things you really lock in from all of this, this next part is it. This is what you absolutely must remember. This table is a fantastic little cheat sheet because a lot of these infections can seem similar at first, but they each have their own telltale signs. For toxoplasmosis, remember that classic triad: hydrocephalus, widespread calcifications, and eye problems. For rubella, think cataracts, deafness, and heart issues. For CMV, it's those specific periventricular calcifications and hearing loss. For herpes, you're looking for those skin blisters and eye infections. And for varicella or chickenpox, you can see some really unique scarring and problems with the limbs. Look, whether it's sepsis after birth or a torch infection during pregnancy, the single most important message, the bottom line, is this: spotting the signs early and getting medical help immediately is everything. You have to trust your gut. If you feel like something is wrong with your newborn, don't second-guess yourself. Don't wait. Getting help quickly can literally change everything. There is no doubt that these conditions are terrifying to even think about, but knowing about them isn't meant to scare you. It's meant to prepare you. Knowledge is your best first line of defense. It turns that feeling of anxiety into a readiness to act. So I want to leave you with this question. What's one key thing you learned today that you feel is important enough to share with another parent or caregiver?